Recording? Alright. Alright, so my name is Ryan Shishkin. I'm a nursing student for the BSM program, and I will be being filmed performing a full head-to-toe assessment for my advanced health assessment class. Alright, first thing we want to do is ensure the right patient and the patient's privacy. So before we approach the patient in their room, we always knock first to make sure. So knock, knock, knock.
Come in.
Thank you. All right, good morning, Mrs. Shiskin. My name is Ryan. I'm going to be your nurse today. Can you please give me your full name and date of birth?
Megan Shiskin, May 29th, 1991.
All right, the reason we do that is because we want to ensure we have the proper patient, and we normally do that with two forms of identification, usually the name and the date of birth, possibly a hospital number that they give them as well, depends on your facility. Throughout the entire procedure, we're going to ensure her privacy, make sure that either the door is closed or the curtain is drawn, and during the objective part of the assessment, that only the parts that are pertinent to my current assessment are exposed. There's no reason for her to be naked the entire time. I'm going to go ahead and use proper body mechanics throughout the entire time. If I need to pick anything up or bend down, I will bend at my knees, not my waist, have a proper stance and gait. Go ahead and pivot and turn and whatnot. And what we're going to do today is a full head-to-toe assessment. It's going to start with me asking some questions about your condition, any kind of family history, what brought you in here, and then we'll go into an actual objective assessment with me going ahead and inspecting, light palpation, light touch, and auscultating, listening with my stethoscope. Cool?
Okay.
All right. So first thing we're going to do is the subjective portion of our assessment, and I'm going to go ahead and sit at level with my patient, and we're just going to have a nice dialogue. This is to gain rapport with the patient over my video man sneezing, and get to know some information, everything about the nursing assessment process and treatment plan is based upon assessment. And the subjective assessment is just as important as what we can see with our eyes by listening questions. So Megan, what brings you in today?
My throat's a little scratchy. And it's sometimes, my sinuses have been acting up, and I don't know if I have the cold or what. I've been doing a lot of coughing lately, and my nose has been really runny. So yeah.
So you think
hoping to get something.
You might have the cold or the flu or something?
Yeah.
How long have these symptoms been presenting?
About 2 days.
About 2 days?
Yeah.
All right. Is there anything that you've noticed that if you do, it helps those symptoms or it makes them feel worse?
If I drink water, especially cold water, it feels good on my throat. Or if I have like yogurt or something, that feels good. If I talk a lot, or if I exercise or run or something like that, it tends to get worse.
So if you physically exert yourself, walking upstairs, on the block and stuff like that.
Yeah.
All right. Are you currently taking anything to treat those symptoms?
Over-the-counter Mucinex.
Okay.
I've been taking there's 2 pills in the pack, in each pack. So I've been taking about 2 of those during the day and then 1 nighttime to fall asleep at night.
Okay. So you take them about 4 to 6 hours apart?
Yeah.
2 daytime during the day and then 1 right before you go to bed?
Yes.
Okay. Are you currently up to date on your immunizations? Have you had a flu shot?
Yes, I have.
Okay.
Actually, I don't know if I'm up to date on my flu shot. Last time I had a flu shot was, I want to say, in February.
February
this year? Yeah.
Okay.
I'm up to date.
They're typically good for a year.
Oh,
You get them once a year, yeah.
Okay.
Sometimes you get them seasonally, summer and for winter. Are there currently any medications that you're taking right now that don't pertain to your possible cold?
Yeah, I'm taking birth control, and I am taking sertraline for anxiety.
Okay, and the birth control is just 1 pill daily?
Yes.
Okay.
It's Azarac.
Do you have any kind of conditions, any kind of high blood pressure, heart disease, diabetes, anything like that? I know you mentioned anxiety. Anything besides that is a chronic condition, or any kind of past surgeries that you've had?
No past surgeries. I do have restless leg syndrome.
Okay.
I've been diagnosed with that, which runs in my family also. My mother, my grandmother, my aunt runs the female line.
The
I
whole
guess.
family's got
The
it.
whole family's got it.
Gotcha.
Keeps me from sleeping. It's hard. You'll see me like fidgeting a lot.
Okay.
Other than that, no diabetes. My grandmother had diabetes,
Okay.
and high blood pressure. And my father has high blood pressure and high cholesterol,
But for you,
but for me,
you don't have any of those. Okay.
mm-mm.
How long have you had the restless leg syndrome?
I was diagnosed with it about 5 years ago.
Okay. Is there anything that you do to help that?
I was
Take
taking
it.
medication for it, but it wasn't helping me. It was giving me dry mouth and all just side effects that I wasn't feeling.
Okay. So it wasn't helping, it was giving you bad side effects.
Yeah.
So you're not currently taking that?
No, I'm just gonna deal with it.
Okay. Well, after this head to toe assessment, we'll look into that further and see if we can help that some other way.
That'd be nice, thank you.
Perfect. All right. Are there any what's your your usual nutritional intake? Do you eat 3 meals a day, breakfast, lunch, dinner, snacks in between? Do you tend to skip meals? What's just your normal on a day-to-day basis, your eating habits?
Don't normally eat breakfast. If I do, it's a yogurt or some cereal. But I will have lunch, I will have dinner. Meat, potatoes, vegetables. I do have vegetables. I'm not a big fruit intake person. Don't really care for it, even though I know I should. I don't drink a lot of water except when I'm exercising or when I'm sick. I do drink Gatorades, and I don't drink soda.
So you drink like Gatorades and like juices and stuff like that?
Orange juice, apple juice, fruit juice.
Okay. I will suggest you drink more water.
Okay.
It's definitely a lot healthier than those high sugar juices. They're nice for a treat every once in a while, but primarily you should be drinking water. Do you currently smoke, or have you smoked in the past?
Never have, never will.
Okay. Any kind of illicit drugs?
No, absolutely not.
All right. Do you drink at all socially? How often do you think you drink? Do you have one a day, multiple a day, once a week?
Only when I go out with friends, which is maybe like once a month, once every other month. And if I do, I only have like 2 glasses of something, and I'm usually gone by then. So.
All right. So socially, once every blue moon. Okay. How about your current menstrual cycle? Is it regular, irregular? Have you had any kind of complications with it?
I did when I was younger. I had a lot of, I would go months without a period. Once I started the birth control that I'm on now, though, I'm extremely regular. It comes on time every month.
Okay. Have you had your most recent menstrual cycle?
Yes, it just finished on Saturday, actually.
Okay, so you're not pregnant. Certain medications and stuff like that would be, it's important for us to know that. All right, well, I believe that's a good amount of subjective information for us to go off of for the moment, and we're gonna move on to our objective assessment, which is less what she's telling me, how she feels about it, and it's gonna be what I'm physically seeing with my own eyes. The first thing that we're going to do for our objective assessment is just a general overall appearance. And we were doing this the entire time we were doing the subjective as well, is noting any kind of just her current state in general. Is she any kind of distress, primarily respiratory distress? I mean, we wouldn't have gone through that whole subjective assessment if she wasn't able to breathe, or if right now, just us talking, was eliciting, heavy breathing, out of breathness, and stuff like that. So I'm going ahead and I'm looking. She looks to be perfectly fine. During the subjective assessment, I was noting her cognitive status, her appropriateness of her responses, her thought process, the pattern, her speech patterns and everything. Everything was appropriate. She maintained eye contact and everything, responded appropriately throughout the entire process. She doesn't have any nasal flaring, intercostal retractions, any kind of labored breathing or anything like that. Generally appearance, with the exception of that cough, she's looking perfect. So So then also the first thing that we're doing also is I'm gonna go ahead and I'm gonna take a note. Does she have any kind of drains, any kind of Foley catheters, any IVs? Is she hooked up to any kind of supplemental oxygen? Does she have any splints or casts or anything like that? Anything that would help me go towards a certain instance and focus my assessment more, which she does not have anything. She seems to be in pretty good health with the exception of the possible cold or flu. So before we go into any kind of head to toe assessment, we're going to check her vital signs. Do this for every patient. We're going to do her pulse, blood pressure, respirations, temperature, and assess whether or not she has any pain. First thing I'm going to do is, do you currently have any pain right now anywhere?
My throat's it hurts a little.
Okay, only in your throat?
And my head. I kind of have a headache from my sinuses.
Gotcha. If you could rate that pain on a scale from 0 to 10, 0 being non-existent, 10 being the most excruciating pain you've ever felt, what number would you give it?
About 2 or 3.
About a 2 or a 3?
Yeah.
Are you currently taking anything to help that headache or the throat pain?
I am taking Excedrin for my migraine,
Okay.
and I am taking Hall's cough drops
Okay.
for my throat.
Is there anything special about the cough drops? Do they have anything extra to them, or is it just the candy that just dissolves in your mouth?
It's got some kind of gel in the middle of it that coats the back of my throat to help. That's all I really know about it.
And that seems to help?
Yeah.
Okay, so that's something that you've been doing to help that, the halls and the headache.
Yes.
You notice anything besides, I know you mentioned earlier, if you talk a lot or exert yourself, is there anything besides that causes that pain to increase?
No, not really. I wouldn't say so. Did have wings yesterday, and the hot sauce kind of hurt the back of my throat a little, so won't be doing that until I feel better.
Okay, so we'll stay away from spicy foods,
Yes.
high season foods and stuff like that. And I assume the throat pain started right around 2 days ago when the coughing started?
Yes.
Okay, just want to make sure it wasn't from anything else.
Yeah.
We're going to go ahead and listen to her, we're going to take her blood pressure, and what we would do is I'd go ahead and I'd find her brachial pulse, put a cuff on her, blow it up until I can't hear the pulse anymore, and I'd slowly deflate it until I can hear it, and then until I can't hear it any longer. And that will give us our systolic over diastolic pressure. I'm going to go ahead and check her her pulse oximetry, and what that is, it's just going to be a plastic device. I'm going to go ahead and stick it on your finger. It's like a little paper clip. It doesn't hurt, but you will feel a little pressure on it because it will stay on. And what this is going to do is just going to measure the concentration of oxygen circulating in your bloodstream.
Okay.
We want this to be 95 and above. You know, normally a nice 99 or 100 is what we'd like to see. If she had any fingernail polish on right now, that could skew the result, and I would take that off of whatever finger I would normally be assessing with, but she doesn't have that on right now, so that's not an issue. I'm going to go ahead and just ask you to just relax for a second. What I'm doing right now is I'm counting her respirations. You don't want to tell them that you're counting their respirations because most people will unconsciously or on purpose alter how they're breathing because they want to please us and be good patients and not be in any danger. We want to get an accurate result. So what we're going to do for this is, regardless if it's regular or irregular, I'm going to listen to a full minute just because it's a new patient and I want a very accurate baseline. So I'm looking for the chest rise and fall, and I'm just I have my second hand watch so I can get an accurate minute assessment. And I'm just going to go ahead and I'm going to do this for a minute. I could be pretending to take some kind of notes for a second, you know, anything to take up the time. But we don't want her to feel like we're watching her breathe. Okay, we got 18 respirations. We're looking perfect. It was nice, even, and regular. No issues. Next thing we're going to do is we're going to listen to her pulse. Once again, we're going to listen to her pulse for a full minute to determine an accurate baseline level. I'm going to warm it up. So I'm just going to go ahead. I'm going to listen to your pulse. This is right here. And I'm going to listen once again. I got my second hand watch for a full minute. You're doing great, by the way. Okay. Now during that time, I was going ahead. Oh, you snuck up behind me. I was listening for a rate and rhythm. You know, was it regular? Was it consistent? Did it change at any given time? Were there any kind of extra heart sounds that I could hear without using my bell for the moment? 74, perfectly regular and everything. Nice resting heart rate. And that'll do it for our vital signs after we take her temperature. And we're going to go ahead and we could either take an auxiliary temperature or an oral. We're going to go ahead. Can you go out and say ah? We're going to put this under your tongue. Wait for however long. Take it out. Check it out. 98.6. Perfect. All right. We're going to be checking for, if this was an older patient, any kind of hypothermia, you know, in excess, could indicate an infection. Normally in a young lady like this, we're looking more for a higher temperature. She does present with some kind of cold and flu symptoms, so she might have a fever, but she does not, so we would go ahead and treat that accordingly if that was the case. And now we're going to go ahead into our general head-to-toe assessment. And there's multiple ways that we could do this. General assessment, we could do a systems approach, meaning we just tackle individual symptoms and jump around as they pertain to that symptom. Or, in order to ensure that we hit all their points and we don't miss anything, we're going to start right at the head. We're going to literally work our way down all the way to the toes. Go right ahead. Join the party. All right, so first thing we're going to do is we're going to start right at the head, and I'm going to notice and inspect the general condition of her hair. It looks very healthy. It's not dry or brittle, anything like this. I'm going to go ahead and inspect the scalp, make sure there's any kind of bumps, contusions, or lesions or anything like this, any kind of hematomas, caput or anything like this. And after I've inspected, I'm going to go ahead and palpate any kind of tenderness or anything, and we can go ahead and the patient can tell me if she feels any kind of pain, or I can just notice if she grimaces or kind of pulls away. That'd give me an indication that that's a tender spot. Go ahead and check that, and then we move to the face, and we're going to check just general size and symmetry of the face, any kind of bruising, lesions, raises, any kind of discolorations. I'm going to check the temperature. She looks perfect if you ask me. And then I'm going to go ahead and assess particularly the eyes. Once again, I'm looking for the shape of the eyes symmetrically, if one eye is larger than the other, if they're midline. I'm going to go ahead. Can you go ahead and look at my finger? Can you follow it? All right. And then I'm going to go ahead and check pupillary response, see if they're direct and consensual and reactive to light, what their size and symmetry are as well. Just going to look forward. I'm going to flash this light into your eye real quick. This goes like this. It's a little bright, but it's not too bright. Okay. All right, her pupils are equal and reactive to light. I'm going to go ahead and assess her conjunctiva, check the hydration status of them, any kind of lesions, any kind of bruisings or anything like that. Check to see if there's any kind of drainage coming out of the eyes as well. And then I'm going to move over from the outer canthus and I'm going to draw an imaginary line to see if her ears line up there. And I'm going to go ahead and assess her ears. Externally, I'm just going to be assessing them both from the front and back, inside and out. Check for any kind of tenderness, lesion, bruising, cuts, any kind of drainage coming out of them. And I'm going to go ahead and assess both of them. All right. We're going to pull the hair back and we're just going to assess inside and out. Any kind of tenderness, check behind the ears. Make sure everything's golden. And we can also do assess her hearing. What we can do is we can do a whisper test, stand behind her, whisper something to see if she can hear it, or I can hold my watch up to her ear and I can ask her to let me know when, as I'm pulling it further away, when she stops hearing it. I'm going to go ahead and check down to her nose now, checking location, symmetry, location, whatnot. Any kind of bumps, bruises, cuts, discolorations. She's got freckles. I'm going to check the patency of her nares. Check inside. See if she has any trouble breathing through her nares. Any kind of drainage or anything. I could ask her to go ahead and blow her nose so I can see if any of her nares are clogged, which they most likely one of them will be since she has the coughing, the cold and flu symptoms. Then I'll move down to her mouth. I'm going to check the general status, hydration status of her mouth, the color. Is it nice and moist or is it dry and cracking? That will give us a good indication of her hydration status. Can you go ahead and open up for me? I'm going to go ahead and check out her tongue and her oropharynx. Make sure, once again, we're checking hydration status. Any kind of swollen. See if her tonsils are swollen in the back, any kind of lymph nodes or anything. Open up. You say ah. All right. Her tonsils are not swollen. There is some slight swollen there, and that's most likely from her coughing. And then I'm going to go ahead and put my pen light away, and I'm going to go ahead and go down to the neck area now. Main thing about this, I'm just going to check to see if there's any kind of tracheal deviation. I'm just going to go ahead and palpate, make sure it's midline, it's not deviating left and right. If there was a deviation, that could be indicative of a pneumothorax. And once again, I'm just going to go ahead and check for any kind of swelling, lesions, bruisings, any kind of discoloration, palpate for temperature. I'm going to go ahead and feel her, or I'm going to assess her carotid artery. This is the only artery that we don't assess and palpate bilaterally, because we can cut off circulation and put her to sleep, which we do not want. All right, so we're going to assess that unilaterally. And I'm just going to go ahead and assess and palpate her lymph nodes, any kind of swelling. Okay, and that'll be it for the neck area. Then we're going to go down to the anterior thorax, which would be the chest area. Okay, here I'm just going to go ahead and assess general, same thing as usual, general appearance, symmetry, just in terms of anatomical features, but also symmetrical chest rise and fall. We don't want one side coming up and the other one not. Once again, we could have a pneumothorax if that's the case. So we're going to go ahead and inspect, and we don't have any kind of discoloration or bruising or any kind of indicative marks of damage. So what we're going to do is we're going to go ahead and palpate for any kind of tenderness, palpate the clavicle for any kind of deviations, any kind of pain. Then we're going to go ahead and auscultate. What we're going to do is we're going to listen to lung sounds and heart sounds at this point. So what I'm going to do is I'm going to listen to 4 spots, right here, 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 and here. All right, and I'm gonna listen to both this side and this side. Okay, warm them up. So on her right side, we're gonna listen to the aortic, which is gonna be right sternal, second intercostal. Okay, and we're gonna go left sternal, second intercostal. And then left sternal, right. And then the mitral. And I'm gonna go ahead and listen with the bell as well. Right now we're listening for any kind of murmurs or bruise or anything. Okay. And then I'm going to go ahead and assess her lung sounds. There's 10 spots on the front of her chest, 4 on each side, and 18 on the back. And each time I place my stethoscope down, you're just going to take a nice breath in and out, okay? Fake breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right. Normally we would do this underneath the clothing, skin to skin contact, makes abnormal sounds. We're going to go ahead and both sides, 4 spots. 1, 2, 3, 4. Same thing. We're going to go 1, 2, 3, and 4. And then we're going to come around to the back. Start up here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and 16. And then 17 and 18 come in close. Okay? And I'm also, throughout this entire time, I'm just noting the general appearance of her skin as well. Hydration status, we can go ahead and pinch, see if it tense, palpating the temperature of it, notice the skin color, and everything like that. All right, and then real quick, do you sleep? How many pillows do you sleep with at night? And do you have any trouble? Do you raise the elevation of the bed or whatnot?
I sleep on a pretty thick pillow, just one pillow. Mm-hmm.
So one pillow, but it's nice and thick.
Yeah.
So you're not laying flat, you're laying down.
Yes.
Okay. And do you have any trouble staying asleep once you get to sleep?
Yes, I do. I wake up maybe 1 or 2 times a night.
Do you notice that's to go to the bathroom or just in general?
That's usually for the bathroom.
Okay. We'll talk about that more in a little bit. Okay. And then I'm going to go ahead and ask you if I can help you up. And if you could lay down for me so I can do an abdominal assessment. You lay down. Once again, we're going to go ahead and inspect first any kind of pulsations, symmetry, contusions, abnormality. Check the umbilicus, same color as the skin color around it. Once I've noticed, go ahead and inspected it. I'm going to go ahead and listen, and I'm going to listen for bell sounds. I can't move on to the next section until I've listened for a full 5 minutes of not hearing any kind of bell sounds. I'm going to start with the lower right and move my way up. Here, we want to auscultate first before we palpate, because palpations and percussion can skew our results. Also, while I'm down here, I'm going to auscultate for any kind of bruise, and using the bell of my diaphragm, I'm going to go ahead and start at the aortic artery, come down to the renal, and then the iliac, and then move down to the femoral. Okay, and then I will go ahead and do some light palpation. I'm just going to go ahead and press down. You let me know if you feel any kind of pain, any kind of tenderness.
No.
I'm looking for rebound tenderness, guarding, grimacing, anything like that. I'm going to go ahead and I'm going to hit my finger when my finger's on you. It's called percussion. Over organs, I should hear a dull sound because the sound is traveling through that solid mass. Over lighter spaces, I should hear more of a tympanic sound. I'm going to go ahead and ask you to stand up. Did you go to the bathroom before this assessment?
Yes, I did.
Okay. While I was down there, I would also be palpating for bladder distension and everything like that. When was your last bowel movement?
Last night.
Last night. General, consistent with your normal habits
Yeah.
in terms of consistency and everything. What are your general, any kind of unusual voiding habits being? Do you feel like you've been being a lot lately? Do you have any pain? I know you said you wake up during the night to pee sometimes.
Yeah, I pee a lot actually.
You pee a lot actually?
Yeah.
Yeah, you got the bladder of an infant?
Yeah, pretty
Gotcha.
much. Mm-hmm.
Has that always been like that? Or is that something that you've realized recently due to the sickness?
It's always been like that.
Okay. All right, so we'll look more into that later after the general head-to-toe assessment. That'll be a more focused assessment, see if we can clear anything up there. Now we're going to go ahead and we're going to assess the extremities. We're going to assess the upper extremities first. We're going to go ahead, like I said, everybody knows if there's any kind of traction or casts or anything like that. Assess temperature. Can you go ahead and move your arms up? All the way up, all the way down, go like this. Checking her range of motion, see if she can abduct and adduct her limbs. Can you go ahead and press up on my arms? Okay, can you press down? Cool. Can you go ahead and squeeze my fingers? Harder? Cool. Checking her strength, her neurological status, if she can follow simple commands and has control over her bodily functions. I'm going to go ahead. Can you go ahead and touch your nose? Your finger? Can you do it with the other hand? Cool. See if her coordination of her movements and everything. I'm going to go ahead and assess her pulses, her brachial pulses. These, unlike the carotid, I will assess bilaterally for rate and rhythm. See if they're bounding or anything. I'm also check her radial pulses. I'm going to go ahead, once again, I'm always assessing the skin color for any kind of lesion, skin color and everything like that. I'm going to go ahead and assess cap refill. What I'm going to do is I'm just going to press down on your nail and watch it blanch, which means it goes white, and then watch the color come back. Comes back within 3 seconds. It's a healthy, less than 3. Your blood's returning very quickly. If not, it's something we're going to look into as well. We're good there. And then we're going to go ahead and assess her lower extremities as well. Once again, any kind of tractions, casts, slings, or anything like that. I'm going to go ahead and assess the normal color, temperature, and everything like that first. I'm going to go ahead and I can assess the pulses, her femoral pulse, her popliteal pulse, which is behind her legs, her posterior tibialis, and her dorsalis pedis pulses. Checking these bilaterally as well. I'm going to check cap refill as well. Press down, both. Can you go ahead and press my feet now? My hands down. Cool. Can you raise your legs up? Cool. Also, on both upper and lower extremities, I'm assessing for any kind of edema, pitting or non-pitting, and everything. We're looking good. I'm going to go ahead and do you use any kind of assisted devices for walking, canes, walkers, wheelchairs, anything like that? You don't have a good balance and gait. I'm going to ask the patient to stand up. And I'm going to check out the curvature of her spine. Make sure there's any kind of gross deformities. Make sure it's nice and midline. Doesn't go back and forth, scoliosis, lordosis, kyphosis, like that. Do you feel dizzy at all?
No, he's not.
I'm going to ask you to go ahead and take a couple steps. All right, take a couple steps back. I'm noticing the coordination of her movements, the fluid, if she's losing balance or anything like that, how strong her gait is, anything, any kind of abnormalities and stuff like that. And we're looking good there. You can go ahead and take a seat. And also, we would go ahead and assess the genitalia and the rectum at one point and make sure privacy is intact as well. We're going to look for any kind of swelling, abnormal masses, or drainage, anything like that, any kind of issues going to the bathroom. And once again, go into whether or not she has any kind of irregularities with her menstrual cycle, which we already went over. And let's see. I believe that wraps that up. Thank you so very much for watching. I hope you enjoyed, Professor, and I'll see you soon. Bye.